Ever heard of a surgery that was so not needed that it ended a young man's life before it really began? Hello everyone, and welcome back to this YouTube channel. Today we're diving into a story that will break your heart and also make you enraged. It's a story about a young man, a regular medical checkup that went sour, and a surgery that unfortunately should never have happened. Imagine yourself to be a healthy young person at age 22, studying to be an emergency medical technician with your whole life ahead of you. That was Michael. He had a passion for helping others. Michael had a bright future in healthcare, and everyone who knew him loved him. On one fateful day, however, Michael fainted, and this saga would go ahead to turn his world upside down. Michael went to the doctor for inquiries, but instead of getting the care he needed, he was rushed into a fatal brain surgery. This surgery, as we'll soon reveal, was completely not needed and eventually ended his life. In this video, we're going to fully examine this sad medical story. We will learn who Michael was, what went wrong in the process of his treatment, and how his family fought for justice. Expect that this story will shock you, make you angry, and hopefully make you rethink the healthcare system we all depend on. This is the tragic case of Michael Skolnik and the surgery that never should have happened. All right, before we talk about this medical mess, let's learn all we can about Michael himself. Michael was not just a patient. He was also a son, a brother, a friend, and a young man with so much potential. Michael grew up in a small family within a small town and was known for his infectious laughter. He had a kind heart and he was passionate about helping others. He was very jovial and sociable, always cracking jokes and making everyone around him feel relieved. Michael once crept up slowly behind his unsuspecting mother like a mischievous child and crack, he had a perfect shot. A broken egg scrambled on his mother's face.
When he was 7, he thought it would be the funniest April Fool's prank to break an egg on Patty's face.
According to his mother, Patty, while wondering if he knew the gravity of what he just did, said, "But then you had to laugh because Michael just made you laugh. He was such a character." But Michael wasn't just fun in games. He was also hugely driven and determined. He had always wanted to be a nurse, and he was working really hard to make that dream a reality. He was a brilliant student in his nursing program, getting top marks from time to time and earning the respect of his professors and colleagues alike. If you were in the same room with Michael's professors, you'd often hear them talk of his natural ability to connect with people, his empathy, and how he genuinely wants to make a difference in the world. He was so enthusiastic about medicine, and he spread this enthusiasm to others around him, believing strongly that he could use his skills to help others.
Such major life decisions like this, and alternative options and risks should always be disclosed to the patient and their loved ones.
Michael volunteered at a local clinic, and in no time, the patients already loved him because of his warm smile and how he was able to make them feel heard. You can already guess that Michael loved spending time outdoors, exploring nature, challenging himself physically, and engaging in physical activities. Of course, you'd understand that such physical fitness is needed for a nurse who'd be prompt and perfect, especially one currently working as an emergency medical officer. Sadly, Michael's life took a sudden and unexpected turn when he fainted one day while playing with his dog. He had always been healthy and active, so this saga was a huge surprise to everyone who knew him. In fact, he informed his family by himself after he had woken up, and they took him to the emergency room of the hospital, where doctors ran a series of tests, hoping to find an explanation. Initially, it was thought that his passing out was just a seizure, one that came as a side effect of Wellbutrin. Well, let's not hate the innocent Wellbutrin, because it was just an antidepressant that Michael had been taking in order to stop smoking. Do you know why we are not hating on Wellbutrin? It is simply because the first spinal tap that Michael was subjected to in order to fathom if there was something wrong in his brain, especially since he admitted to the doctor about the medications he had been taking, came with inconclusive results. You may be wondering what a spinal tap is, though. If a spinal tap is to be conducted, a long needle is used to get some cerebrospinal fluid out of a patient's back. The cerebrospinal fluid, which is often called CSF, is the fluid that circulates around the brain and spinal cord. The sample of fluid collected is used to determine the presence of certain medical conditions so that suitable treatment can be administered. Simply put, it is done in order to test it to see if there's something wrong with the brain. Now here's the real deal. Since the results of the radiology test were inconclusive, the doctor decided to run a CT scan, and it showed that Michael had a tiny dot on his brain called a cyst, which was just 3 millimeters in size. To be more exact, the radiologist wrote that there was a tiny round hyperdensity, which may represent a very small cyst, but which does not seem to be capable of creating any ventricular obstruction. Then he recommended at this time further evaluation with MRI. At first they were on the right path, addressing the dot as probably genetic and passive, meaning not much harm.
But then they did a CT, and they found at the CT a small dot in the third ventricle of Michael's brain.
After the MRI, The result remained that a small 4.2 mm area, which most likely represents a colloid cyst and causes no ventricular obstruction, was noticed. This should be good news, right? Well, Patty, Michael's mom, reached out to a neurosurgeon as a means of getting a second opinion. You wouldn't expect to get a neurosurgeon on the phone that fast, but Patty admitted she didn't quite notice that as a red flag for a surgeon. You would have also expected the surgeon to simply monitor this dot and give a milder but accurate diagnosis. But guess what? The neurosurgeon on call took a more aggressive approach. He convinced Michael's family that he needed to be placed under observation in the hospital, and the dot could be handled like a ticking time bomb that could rupture at any moment, and which required emergency brain surgery as the only option, with death as a possible effect of slacking. Let us even discuss this surgery decision more extensively. If you want to summarize the decision, just call it a series of medical errors and a rush to judgment. The tiny dot on Michael's brain, which caused his fainting saga, was later determined to be a cavernous malformation. Sounds scary, right? But here's the thing. When you talk about cerebral cavernous malformations, or CCMs, you mean groups of tightly packed, irregular small blood vessels with thin walls. You may find them in the brain or spinal cord. The vessels contain slow-moving blood that's usually clotted. CCMs look like small mulberries. In some people, they can cause blood to leak into the brain or spinal cord. Common symptoms of this include headaches or seizures, so you can understand what Michael had. Most of the time, these formations cause no problems. Many people never know that they have one. So the thing is, these malformations are often harmless. They're basically a cluster of abnormal blood vessels, and they're actually pretty common. Many people live with them their entire lives without any problems. In Michael's case, the malformation was so small and located in an area of the brain that didn't typically cause symptoms. Experts who later analyzed his situation concluded that observation and monitoring would have been the best course of action. There was no urgent need for surgery, and the procedure's dangers outweighed the advantages. Well, the neurosurgeon who treated Michael saw things differently. He was a highly renowned neurosurgeon with extensive expertise, but he was also known for being a bit of a rebel. That is, he was known for exerting his independence in making medical judgments that would ordinarily require the involvement of other medical staff. He was known for his aggressive approach to treatment and his willingness to take risks that other doctors might shy away from. Some colleagues even whispered that he had a god complex, believing he could fix anything. So far, he had a scalpel. In Michael's case, the neurosurgeon seemed to really focus on the worst case scenario. He presented the malformation as a ticking time bomb ready to explode at any moment. He used alarming language describing the possibility of excessive bleeding, seizures, and even death. He pressured Michael and his family, making them feel like they had no other choice but to agree to surgery. The decision to proceed with surgery was made quickly, perhaps too quickly. In Patty's words, they didn't even have the time to really think it through. All they knew was what the neurosurgeon told them about the urgency for brain surgery for Michael.
So the next day, I called this neurosurgeon, and the next thing I know, the doctor was on the phone, which probably should have been a red flag to me.
Since a rush to have the brain surgery was already instilled, important steps were overlooked. A second opinion was never sought, and alternative treatments were not discussed or explored. They didn't consider Michael's medical history, even though aside from the fainting saga, there was nothing to be scared of. This neurosurgeon focused solely on the malformation, observed and ignored all other factors. The surgery itself was long and complicated. It involved opening up Michael's skull, navigating through delicate brain tissue, and attempting to remove the malformation. The plan, which was pictured to be very urgent, was to insert a drain into his brain to relieve the pressure and the fluids that were filling up the brain at the time. Michael and his family were worried and scared, but they trusted the doctor's expertise, especially regarding his analysis of the time frame they had. They never imagined that this decision would have such devastating consequences. They all wanted Michael to bounce back quickly, return to his studies, and continue pursuing his dream of becoming a nurse. Patty acknowledged that at that point, all she felt was in fact grateful. She was grateful because to her, this savior who came in the form of a neurosurgeon had just detected what they could not detect at the emergency room where Michael was first taken to, and now he was very keen on doing what he does best to save his life. But as we'll soon see, that was not to be. So in essence, the process and principle of informed consent were not properly implemented by this neurosurgeon. You can't blame Michael's parents for not cautioning him, and don't forget, Doctor is a maverick. He didn't have to be checked by anyone, sadly. Shall we briefly examine what informed consent is all about so you'd understand this perfectly? Why not? According to the National Center for Biotechnology Information of the National Library of Medicine, when you have informed consent in place in any given situation, the healthcare provider is expected to educate a patient or their kin about the risks, benefits, and alternatives of a particular procedure or medical intervention. This is even more vital for a highly risky procedure like surgery, not to talk, or brain surgery. The patient must be competent to make an optional decision about whether to undergo the procedure or intervention. Ethically and legally, medical practitioners in the U.S. are obliged to ensure informed consent exists in their dealings with patients, and this originates from the patient's right to direct and determine what happens or what is done to their body. To provide informed consent, the patient's understanding has to be assessed, an actual recommendation must be made, and the process must be accurately and painstakingly documented in a form, progress notes, or anywhere else in the record. To document the process of discussing informed consent, the following information is required: the nature of the procedure, the risks and benefits of the procedure, the reasonable alternatives available, a detailed analysis of the risks and benefits of alternatives, and an assessment of the patient's understanding of the preceding 4 items. It is also the healthcare provider's responsibility to indicate in the paperwork that the patient is involved in the decision-making process. They must avoid making the patient feel forced to agree with the provider or to the procedure. Rather, the provider must make a recommendation and provide their professional thoughts regarding the said recommendation. In all these, the family of the patient fills in when the patient is incapable of handling the consent by themselves. In the midst of all these, our neurosurgeon continued to emphasize why this drain was so imperative, and as such, reaching a unanimous decision with these frail and expectant parents and getting a sick Michael to sign the consent form was not too difficult. It was just a normal procedure. According to Patty, the neurosurgeon did not tell them that there were any risks. He only highlighted the benefits of the process, and they were more preoccupied with the fact that he was going to save their son.
I think we were just so naive at that point, and were just so relieved that he was going to save him.
Michael's father was expecting that the neurosurgeon had the necessary technology to accurately insert the drain as he told them he would, only to see him use a hand drill into his son's head in the latter's room rather than an equipment-filled operating room. While he can't judge whether it was the right choice of apparatus, the process sure was screaming informal and impulsive. Now you can begin to connect the dots on the various areas where this neurosurgeon faltered. The mess hasn't yet ended. Michael received excess sedatives to the extent that he had to be assisted to breathe, and Michael's father heard that from one of the nurses assisting the neurosurgeon. When he was to ask the neurosurgeon himself whether Michael was okay, and if indeed he had an arrest, the former only concerned himself with how the latter got wind of that, rather than effectively clarify the situation. All Patty wanted to see happen was Michael in an alright state, with evidence of recuperation. But she got bad news. Patty and her husband would get home to meet another hint that they are in for a big problem. Their primary healthcare provider dropped them a fax message confirming that what the neurosurgeon tagged a normal, urgent, and compulsory procedure was actually unnecessary. In this new light, the cyst was, in his words, benign. It cannot experience any change. Neither can it be a cause of any health issues Michael might be facing. For parents who have had to digest so much health information, they did exactly what anyone would have done. Look forward to showing the neurosurgeon their new confirmation the following day. Patty just couldn't wait to show the neurosurgeon the actual possibility that what she wanted could happen. Michael is fine, no risks, no fears, no problems. If you can already sniff a plot from afar, what do you think the neurosurgeon would say? Well, I can bet you guessed right. In simple language, let's typify what his response looked like, though not literally. Why are we still having this conversation? You should trust me and listen to my professional advice ahead of that of your primary healthcare provider. I know this better than you two as well, just trust me. Still in the midst of these, Michael was getting excess medication in what you would consider a medical rush hour. In that state, where you can't effectively say this is how Michael was physically and mentally feeling, he still had to sign a consent form for surgery, without Patty and her husband being there to even oversee effectively. Our surgeon has not stopped. As can be seen here, he tells Michael's parents that yet again, additional surgery is what is needed to remove the cyst in his brain, and it had to be done within 48 hours to save his life. Don't forget, we described this neurosurgeon as one who spoke in an alarming tone, and much more than caution, precision, and meticulous examination, he spelled out urgency the more. As you can already infer from what we have seen so far, things didn't go as planned for Michael's brain surgery. Michael's condition would turn out to be what the neurosurgeon would tag as a highlight of his worst year ever in practice. There was excessive bleeding, no cyst was found, and the brain had been heavily manipulated. Michael's parents had to now start to deal with the eventualities, which they never predicted could surface in this surgery that was explained to them as urgent, beneficial, and harmless. Michael suffered a stroke. The once vibrant young man came out of the operating room a shadow of his former self. His parents could not believe their sight of how their son now looked like. He was paralyzed on one side of his body, unable to speak or communicate effectively. He became partially blind and suffered from severe seizures. The next 32 months for Michael and his family would then be full of multiple surgeries, systemic infections, deep vein thrombosis, pulmonary embolism, DIC, and sepsis. He suffered from paralysis, psychosis, respiratory arrest, and an endocrine system failure. He was partially blinded and unable to speak. He lost his short-term memory and had chronic pains, amidst other complications that Patty and David, her husband, did not see coming, especially as they never caught wind of them throughout their stay in the hospital. He was fed through a tube in his stomach. He needed to be taken care of at every minute, and his dreams of becoming a nurse were already gone. His family painfully had to watch their son struggle to perform even the most basic tasks. Michael's life was forever affected by this surgery that should never have happened. The aftermath was a nightmare. Michael's family was consumed by grief, anger, and guilt. They faulted themselves for not asking the doctor more questions or seeking an alternative opinion to confirm all he said. They felt betrayed by the healthcare system, which they trusted to give their son optimal care rather than endanger his health. In the exact words of David, Michael's father, he really hurt him.
And I said, Patty, he really hurt him. That's the first moment I realized that he really hurt my son.
It just dawned on them that they had actually missed out on a lot that they should have known, and they had the right to know. For instance, they didn't even know that their son had a craniotomy. Very quickly, what is craniotomy? A craniotomy is a type of brain surgery. To conduct a craniotomy, a part of the skull is removed by the surgeon in order to have access to the brain. In the same surgical process, the surgeon will replace the part of the skull that was removed and then close the incision site. Craniotomy is used to treat tumors, blood clots, and epilepsy, and it can actually take up to 2 months to fully recover from a craniotomy. Michael would then have to spend the next 22 months in rehabilitation, from getting discharged with a ray of hope to relapsing into multiple organ failure, where it became glaring that Michael would no longer be able to do the basic things he'd have loved to do as a young man, including eating, talking, laughing, and walking. Back home, Patty and David did not relent in giving their son the best medical care he could get, and access to all sorts of medical equipment that could enhance his health. Of course, that would come with some cost, a huge one at that. That left both of them at the mercy of insurance companies, seeking that the latter covers the costs of this fortune-ripping medical endeavor. Michael needed tubes, gastronomy equipment, various injections and medications, aiding medical equipment for daily essentials like excretion and feeding, as well as sedatives to ease him of the pain he was going through. It was indeed a vegetative state for Michael and an agitating one for his parents. All these happened so fast, and now their son was slowly looking dead. Tragic, right? Eventually, on the 4th of June 2004, with a mouthed "I love you" to his dad, Michael died. Before that, in fact, there was yet another tough decision Michael and his parents had to make. Michael was on life support, and his condition was as painful as it was devastating. He had to decide whether to continue on life support or be taken off and passed away. As a means of getting Michael's consent, he was asked to indicate which option he chose by means of squeezing of hand. Once stood for wanting to continue on life support, while twice meant that he be taken off. As you can already expect, this was a tough phase for Michael himself and his parents. This confirmation was gotten multiple times for the next day, just to be sure that whatever type of squeezing he gave was not misconstrued. Each time he had to, Michael squeezed their hands twice, and the message was clear. Patty and David had lost their son before they got clarity on the necessity and the effectiveness of the heartbreaking process their son had to go through. Alas, the procedure the neurosurgeon explained to them as being the only means to saving Michael's life was in fact adjudged by a medical article which they would later get access to be recommended for treating colloid cysts. Not just that. No, the article in fact made it clear that Michael should have rather had an endoscopic surgery, with more advantages and fewer risks. Patty and David did not even get this as an alternative from the neurosurgeon who treated Michael.
The outcome would have been so much different to learn that there was another procedure that could have been done that was less invasive.
If you were to rightly judge the intentions behind this grievous decision made by the neurosurgeon, you can't but see a monetary incentive in it. Rather than provide the vital information that would ensure a patient had the best treatment possible, including if it is only examination such patient needs in fact, what the neurosurgeon did typify a healthcare provider who just wanted to keep putting patients through surgeries and procedures that would mean them coughing up large amounts of money. The mess continues to unravel the more when Michael's parents would also find out that the procedure, which the neurosurgeon described as normal and harmless, and which was very experienced in, was actually a procedure he had only done once before. What do you call that? Exaggeration and understatement in the same scenario, fueled by insincerity. No wonder he had countless legal issues he inherited from medical malpractices, which were also not revealed before Michael and his parents entrusted the former's life to him. The hospital, in fact, also refused to make it known to Patty and David, or Michael himself, that one of the surgeons who should have assisted in this surgery had a dissenting opinion regarding the necessity of the surgery in the first place, and thus chose to steer clear. Yet the surgery went on under the guise that it was urgent. Was it? Now you can imagine why Michael's parents had every right to be angry, bitter, and restless. That is also the reason why they vowed to fight for justice, to expose the truth about the entire issue, and to prevent other families from having to go through the same pain. The Skolnik family was not going to let Michael's suffering be in vain. They were determined to seek justice, not just for themselves, but for all patients who have suffered from medical negligence. They knew that it was a long and difficult path they were to tread, but they were ready to fight. First, they got a lawyer who majored in cases regarding medical malpractice and negligence. After all, they wouldn't take laws into their own hands. This lawyer, being an experienced expert in the courtroom, quickly recognized the ridiculous errors that had been made in Michael's case. He filed a lawsuit against the neurosurgeon, the hospital, and many other medical professionals involved in Michael's care. As you would expect, it was a long and exhausting legal battle. What else would you expect in a case between embittered parents and a maverick of a neurosurgeon? There you have it. Countless hours of depositions, expert testimony, and heated courtroom arguments. The Skolnik family had to relive the trauma of Michael's surgery and its devastating effects over and over again. It was emotionally draining for them.
You should have to go through this. No parent should have their child die before them.
But they endured it, especially as they were motivated by their love for their son and the burning desire to hold those responsible accountable for their actions. In the end, Patty and David reached a settlement with the hospital and the neurosurgeon. Even though the terms of the settlement were not to be revealed, we can also assume that a significant amount of money was involved. For Michael's parents, however, the settlement was never about the money. It was about sending a message to the medical community that tolerance for reckless behavior and disregard for the safety of patients had to stop. That isn't the end. Patty Skolnik founded Colorado Citizens for Accountability after her son's death. The efforts of the parents led to the establishment of House Bill 1331, the Michael Skolnik Medical Transparency Act. This act requires the Colorado Board of Medical Examiners to commence the publication of information about claims of malpractice against doctors in Colorado to protect patients. The rationale behind it is to make patients well informed so they can make the best decisions about their healthcare providers. The Skolniks didn't stop there. They used the settlement money to establish the Michael Skolnik Foundation, a non-profit organization dedicated to improving patient safety and preventing medical errors. The foundation sponsored research, education, and advocacy efforts targeted at making healthcare safer for everyone. They also became relentless advocates for patient safety. They accepted speaking engagements at conferences, gave their testimony before lawmakers, and shared their stories with everyone who was interested in listening. Their aim was to get people aware of the dangers of medical errors and how important it is to ensure patient empowerment in healthcare processes. They encouraged patients to ask questions, seek second opinions, and advocate for themselves. The Skolniks were featured in several news articles and documentaries. In 2014, they were a part of the Telluride East Patient Safety Summer Camp, and by that time, they had shared a documentary film espousing the story of Michael Skolnik and their family's story, with tens of medical and nursing students and resident physicians. They received awards for their advocacy work, and they inspired many others to join in the fight for patient safety. Michael Skolnik's story reminds us, sadly, that even in the 21st century, medical errors are still possible and deserve attention. The story also offers everyone valuable lessons that we can all learn from. First is the importance of informed consent. Before going through any medical procedure, especially major surgery, patients must be fully aware of the risks and benefits involved. They need to understand the possible complications and how likely it is for the process to succeed. They need to be given the opportunity to ask questions and seek second opinions, rather than rushed and hushed processes of consenting in the guise of urgency and fear. That was the problem with Michael's case. He was rushed into surgery without fully understanding the risks involved in it. He was not given the opportunity to examining the alternative treatment options that existed or seeking a second opinion from another neurosurgeon. This lack of informed consent was a major factor in his tragic outcome.
There was somebody who decided that he was competent to do this operation of so many he told us he did.
Also, Michael's story places emphasis on why it is important that patients are empowered to actively participate in their own healthcare. They need to be able to comfortably ask questions, challenge their doctors, and seek out additional information. They should never be under pressure to agree to a treatment plan they don't fully understand or feel comfortable with. No matter how vastly experienced the medical personnel in charge claims to be, or how seemingly obvious the medical condition itself is. In Michael's case, he and his family trusted the doctor's expertise and authority. They didn't feel empowered to question his judgment or seek a second opinion. This blind trust ultimately cost Michael his life and caused regrets for Patty and David. Furthermore, Michael's story reveals the harm in rushing into surgery. In many cases, surgery is necessary and actually does save lives. However, it's not always the best option. Sometimes a milder approach, such as proper observation and monitoring, can be the wiser choice. It's important for doctors and patients to carefully examine the risks and benefits of surgery before deciding. The rush to give Michael surgery was an error that cost him his life. If the doctors had taken more time to assess his condition and explore alternative treatment options, Michael might still be alive today. All stakeholders in the healthcare system, from hospital management to healthcare providers to patients and families, need to be transparent and accountable in their endeavors. Medical errors are often swept under the rug and hidden from patients and the public. This lack of transparency is what makes it difficult for persons involved to learn from mistakes and prevent future occurrences. In Michael's case, the hospital in fact wanted to try to downplay how severe the error was and avoid responsibility. It was only through the persistence and advocacy of the Skolnik family that the truth came to light. Michael Skolnik's story painfully reminds us of how medical errors and negligence can cost people their lives. However, it is also a call to action. As we have learned from his case, we must walk the talk by taking steps to improve patient safety as a means to honor his memory and prevent other families from experiencing the same heartbreak. Let's do this, shall we?